I'd like to thank my colleague from Iowa for her comments and also for her organizing this event this afternoon. This is an opportunity for us to talk about some things we've done here in the United States Congress that are positive in terms of addressing the largest drug crisis we've ever faced in our country, but also what we need to do going forward and how we need to keep our eye on the ball to be sure that we don't see more addiction coming. We don't see some of these new dangers like crystal meth and other drugs coming up. So again, I thank my colleague from Iowa. Iowa's been hard hit, so has Ohio. In fact, in 2017, our opioid overdose rate was about 3 times the national average. We've unfortunately been in the top 5 in terms of overdose deaths most of the last 10 years. We've had nearly a dozen Ohioans dying from these dangerous drugs every single day. This has now surpassed car accidents as the #1 cause of death in my home state of Ohio. But what's happened is that since 2017, with a lot of work from a lot of people on the ground, with some help from Washington, about $4 billion in new funding that this body has approved and taken the lead on, with some help, since 2017, we've begun to make progress. Last year in 2018, Ohio had a 22% reduction in overdose deaths. This leads the country in reductions, and we're proud of that because of the lives that have been saved. But we also realize that we came from such a high water mark, that it's important for us to keep the pressure on to continue to make progress. What's happened in Ohio is what's happening around the country, which is the SUPPORT Act, which was signed into law by the President just about 1 year ago, and other legislation like the Comprehensive Addiction Recovery Act, the CARE legislation, and also the state opioid response grants have started to work. I see Senator from Missouri is on the floor here today. What they have done in the Appropriations Committee to fund these projects is making a huge difference back home. I spend a lot of my time working with the community organizations, talking to addicts and recovering addicts. I've talked to certainly a couple thousand just in the last couple years alone, and I will tell you it's working. What's working is more innovative programs back home to close some of these gaps. Recently, I had the opportunity to go out with the REACT team in Columbus, Ohio. They're being funded with about an $800,000 grant from the Comprehensive Addiction and Recovery Act, the CARE legislation. Again, this has been funded by the Appropriations Committee, actually at above its authorized level because it's working. They're closing an obvious gap, which was that people were overdosing, getting Narcan. Our brave first responders were saving their lives, and then those people were going back to the community where they were from, back to the same family or the same group of friends, and unfortunately, the addiction not having been addressed, were overdosing again, and sometimes again, and again, and again. And often these first responders will tell you, these are your firefighters back home. Ask them, we were saving the same person time and time again. Some of that's still happening, but what the REACT team does is when there's an overdose, and when this Narcan is applied, this miracle drug to reverse the effects of the overdose, then there's follow-up. Of course, we should have done it years ago, but we're now doing it. And I'm proud to say that in my hometown of Cincinnati, Ohio, Colerain Township, much of this was started, but now it's spreading around the country, and the Columbus REACT team is one of the best. They go out with firefighters, EMS personnel, with law enforcement, plain clothes, with social workers, with treatment providers, to the family, to the home. And I've gone out with them. I've gone to these homes, and I've met with these addicts. And they say, look, we're here to help. We're not here to arrest you, but we're here to say you need to get into treatment. And unbelievably, because a lot of people are skeptical of this, well, here's an addict, why would they come forward? In about 80% of the cases, in terms of the REACT team, these individuals say, you know what? Okay, I'll try it. That's the first step. And that's the critical first step to get into treatment and then longer-term recovery and begin to turn that person's life around and that person's family and that person's community, because it has devastated all of the above. So this is what's happening with the federal legislation funding innovative projects back home, again, to close these gaps and to make a difference. So I am very appreciative of what our team has done here, Republicans and Democrats alike. In the more recent legislation that was just passed, the SUPPORT Act, we also included something that focuses exclusively on fentanyl. This is really important. It's called the STOP Act. In my subcommittee, we did an 18-month investigation of this. We spent a lot of time on it. We worked hard to make it bipartisan, but also to be sure it was something that would actually work, because we found out that fentanyl, which is the worst of the drugs, it's the most dangerous, it's killing more people than any other drug. Even today, with our success on opioids, this synthetic opioid, coming almost exclusively from China, And at the time, when we passed the legislation a couple years ago, almost exclusively coming through our U.S. mail system, this deadly drug was coming into post office boxes, into people's homes. And what we said to the post office is, you've got to put some screening in place, much like FedEx does or DHS does or DHL or other private sector entities. And guess what? They're starting to do that, and it's making a big difference. They're now requiring advanced electronic data from these packages, showing where it's from, where it's going, what's in it. This allows law enforcement to target those packages and to be able to stop some of this fentanyl coming in. Unfortunately, the post office isn't doing all they should do. Under the legislation, they're supposed to have 100% of packages from China, as an example, being flagged, being screened, and they're not. Right now, we think that they are identifying from China about 88% of the packages. It's not 100% yet. Let's get to 100%. We also find that the Post Office, based on a 2019 audit this year by the Inspector General, that the Postal Service identified and pulled about 88% of the packages from China that were flagged. And that leaves, of course, many packages that are not being flagged. So over 10% of these packages the Post Office can't even find. So let's do better, and we can do better. It's critical that we continue to hold the Post Office accountable, because this is the poison coming into our communities. That's in this legislation. 1 kilogram of this fentanyl is powerful enough to kill about 500,000 people. That's how powerful it is and how this is a true life and death issue. We've introduced new legislation here in the Congress called the Fight Fentanyl Act just in the last week. Why? Because otherwise fentanyl, which is currently listed as a substance on Schedule 1, a Schedule 1 drug, and therefore illegal, is going to come off that list in February of next year. We can't let that happen, of course. And let's not do a short-term extension. Let's put fentanyl on as a scheduled drug permanently. So I see more of my colleagues have come to talk about this issue. My point, I guess, is very simple. We have done some great things here in this body to be able to help our governments back home at our state and local level, and the nonprofits, the people in the trenches who are doing the hard work. Let's keep it up. Let's be a better partner. Let's continue to provide support through the Comprehensive Addiction Recovery Act, through the Opioid Response Grants, through the STOP Act, through other things, to be able to give folks back home the tools they need to push back against this scourge, against this addiction that is devastating our families, our communities. And now we see, with the opioid progress having been made, other drugs coming in, particularly crystal meth, coming in directly from Mexico. So it's not just about this, it's about being flexible enough to be able to approach that as well. We have new legislation on meth that we should also be working on to provide that flexibility. In the meantime, again, the Appropriations Committee is doing its work, sending the funding that's making a difference to save lives in our communities. I yield back my time.